I'd now like to introduce Greg Southam, who's a partner at Davies, Ward, Phillips & Weinberg LLP, who is sponsoring our opening keynote address by the Honourable Jane Philpott. Greg, can you come up on stage? I should also mention that the Minister has kindly agreed to take questions following her remarks. So please get ready. Thanks, Greg.
Good morning, everybody. On behalf of Davies, we'd like to congratulate CCPPP and Mark and his team on the 25th anniversary of this great conference. Davies is pleased to be sponsoring the opening Day 1 keynote at this 25th conference and introducing our speaker, the Honourable Jane Philpott, Canada's Minister of Indigenous Services. Minister Philpott will highlight the challenges in overcoming the infrastructure deficit in Indigenous communities and discuss the need for innovative solutions, including partnerships between these communities, government, and the private sector. Davies is a keen participant in these discussions and their implementation through public-private partnerships. We believe that this model can provide an excellent tool for both addressing the infrastructure deficit, including housing, and as was alluded to this morning, water and wastewater projects, as well as the participation of Indigenous communities in these important projects within their own and within the broader community. The Honourable Jane Philpott was elected as MP for Markham-Stouffville on October 19, 2015, and appointed as Minister of Health on November 4, 2015. Prime Minister Trudeau appointed Minister Philpott as the first Minister of Indigenous Services on August 28, 2017, to continue improving the quality of services delivered to First Nations, Inuit, and the Métis people. Prior to entering politics, Dr. Philpott led an extensive career in family medicine, public health, medical education, and global advocacy for HIV/AIDS. As Mark alluded to, the Minister will be taking questions from the conference app at the end of her remarks, so please fire up your iPhones. Please join me in welcoming Minister Philpott.
Good morning, bonjour tout le monde. Je suis très contente d'être ici avec vous. Merci pour votre accueil chaleureux. I'm very happy to be here, and I want to acknowledge Chief Laforme, thank him for his welcome, and acknowledge that we are gathered on the traditional territory of a number of Indigenous peoples who have walked and lived on this land, the Haudenosaunee, the Métis, and of course most recently the Mississaugas of the New Credit First Nation. So today, Toronto continues to be the home of so many people, including a number of Indigenous peoples, and I'm very grateful for our opportunity to meet in this area. So let's start with the question that some of you are asking. Why is Jane Philpott, Minister of Indigenous Services, delivering the first keynote address at a conference on public-private partnerships? At face value to you, it may seem like an odd pairing. But I'm hoping that very quickly you're going to see the connection, and that you'll also begin to see how you fit into the critical objectives of delivering better Indigenous services across our great country. Let's start with a story to set this in context. It's a story about a girl who died in Ottawa earlier this year. She was a 15-year-old girl from the small, remote community of Qikiqtarjuaq, Nunavut. She had been ill for at least 2 years, but it was not until hours before her death that she received a diagnosis of tuberculosis. In 2017, colleagues, young Canadians are dying of tuberculosis, a treatable infectious disease. But the bacteria is only a small part of the problem. Tuberculosis in Canada is driven by overcrowded housing, nursing shortages, a lack of health infrastructure, language barriers, delayed diagnoses, and much more. It's an epidemic that has persisted in Canada's Inuit communities for more than a century. But this is not a story just about Nunavut and the North. I want you to picture 17 people living in a home built for 4. Picture another community in our country where the roads were so bad that fire trucks couldn't reach it in time, causing the death of 9 people, including a baby. Picture your home in Canada without an indoor bathroom or running water. Picture a suicide pact among children as young as 10 in a community in this province where children doubt that there is hope for a brighter future. These situations are happening in Canada today, and they are unacceptable. Basic infrastructure needs that most Canadians take for granted are missing in far too many Indigenous communities. From reliable access to safe drinking water, to basic medical care, all-season roads, quality housing and schools, shelters, broadband connectivity, cultural and recreational spaces, what most of us consider essential for our quality of life is absent from the daily reality for thousands of Canadians. The status quo is not an option. Waiting for a more convenient time for us to address these gaps is not an option. So I'm here today to talk about my role in this and to challenge you to find yours. I'm Canada's first Minister of Indigenous Services. Let me tell you a bit more about what that means. On August 28th this year, the Prime Minister announced that he was dismantling the old Department of Indigenous and Northern Affairs Canada. And in its place, we are creating 2 new departments, Indigenous Services, of which I have the privilege of being Minister, and the Department of Crown, Indigenous Relations and Northern Affairs, led by Minister Bennett. Service aux Autochtones améliorera la prestation de programmes et de services destinés aux Autochtones et contribuera à combler les écarts socio-économiques. Au fil du temps, de plus en plus de programmes et services seront fournis par les Autochtones eux-mêmes dans le cadre de leur progression vers une véritable autonomie gouvernementale. Ce changement transformateur représente un pas important vers la réconciliation nationale. Il nous fournira les outils nécessaires pour travailler de façon plus efficace et intelligente à servir les Autochtones. For the Department of Indigenous Services, this may be the first government department ever created specifically with its own obsolescence as an eventual goal. This is because the overarching vision is to support the self-determination of Indigenous peoples who rightfully want to and need to control service delivery for their own people. Until such time as that is a reality, the Prime Minister expects my department to enable the services that affect the day-to-day realities for Indigenous peoples. This includes the successful delivery of significant investments made in Indigenous services with both budgets 2016 and 2017. So in Budget 2016, we committed $8.4 billion over 5 years toward building a better future for Indigenous peoples. And Budget 2017 followed with an additional investment of $3.4 billion. Let me talk about the progress on the infrastructure deficit in Indigenous communities. Specifically, we've talked already today about water infrastructure. We have so far funded 348 projects in 275 communities. We've lifted 26 long-term drinking water advisories. We still have 70 to go, but we have action plans for all of them, and we are on track to lift every single long-term drinking water advisory by 2021. On housing, in the last 2 years, we have built or renovated over 8,800 units and in 362 communities, and we're developing long-term housing plans with Indigenous partners. When it comes to education infrastructure projects, including schools, 143 are underway or completed in 120 communities. And health infrastructure, a need that I'm very interested in, we have 121 projects completed or underway in 109 communities. I've had a chance to see some of these projects myself. A couple of weeks ago, I visited Dakota Plains and Long Plain First Nations in southern Manitoba, not far from Winnipeg. In both communities, they have very successful housing projects underway, and you would well know the delight on people's faces when they get to enjoy a new home. So in Dakota Plains First Nation, they have recently built a number of duplexes, and the tenants were just moving into their homes. I heard stories of how it allowed families to reunite, about how a mother was able to see her young adult son come back from the city of Winnipeg, where he was struggling to make ends meet, and was able to return to the family. These duplexes bring pride and stability and hope to that community. And then in Long Plain First Nation, you would have been fascinated to see the community arena. As I walked into the community arena, there was no ice, but it has been converted into a construction workshop, and there were 12 mini homes being built inside the arena, where they are going to be completed and sent off to their destinations. And as I was on the tour of the mini homes, I met a woman who had the opportunity, as all eventual homeowners do in this particular project, to help in the construction of her own home. So we're seeing progress. Critical infrastructure is being built, but there's a tremendous amount more to do. I told you that 26 long-term drinking water advisories have been lifted in the last 2 years. Unfortunately, 19 other long-term drinking water advisories have been added. Unfortunately, too many communities lack the resources or the expertise to build, maintain, and importantly, to operate these water systems. But it affects on a personal level as well. One of the things that deeply troubles me is the crisis that we are facing in this country in the child welfare system, where there is a severe overrepresentation of Indigenous children in care. In provinces like Manitoba, with 11,000 children in care, 10,000 of them are Indigenous. But I started to ask the reasons why children are taken into care, taken from their families and their communities. And it's often these simple realities, well, simple to us, but the fact that there's not an adequate house for a family to live in, that there's severe overcrowding in the home, and that there's lack of access to health services, forcing families to be separated. And as I described earlier, this matter of overcrowded housing is one of the reasons why Canada's Inuit are facing tuberculosis rates that are 270 times higher than the Canadian-born non-Indigenous rates of tuberculosis. So I hope you figured out what this has to do with P3s. Some of you will view your role in P3s in addressing infrastructure gaps for Indigenous peoples as a matter of corporate social responsibility. Others of you may view it from the perspective of enlightened self-interest. But either way, I hope you've figured out that it's smart to invest in Indigenous infrastructure, Indigenous communities, and Indigenous peoples. First Nations, Inuit, and Métis are the youngest and fastest growing segments of the Canadian population, particularly as evidenced by the recent census data. Their economic and social achievements can and will drive Canada's economic future. Last year, the National Aboriginal Economic Development Board analyzed what Canada is losing because of the gaps in employment and economic outcomes between Indigenous peoples and the non-Indigenous population. They determined that closing that productivity gap would mean an estimated increase in GDP of $28 billion annually. That would be a boost of about 1.5% to Canada's economy. For another measure of the magnitude of the opportunities that are available, it has been estimated that First Nations infrastructure deficit alone may be as high as $30 to $40 billion. And that's not to mention the infrastructure needs of Canada's Inuit of the far north. So I hope you'll see the potential for P3s in Indigenous communities. I don't need to convince anyone in this audience of the success of the model. Canada is a global leader, and we're proud of that, in no small part because of the outstanding work of the Council and the leadership from other entities like Infrastructure Ontario, Partnerships BC, and all of you who are leaders in this room. You know how the P3 model is a great tool for building schools and developing water and wastewater facilities, all-season roads, broadband connectivity, and energy infrastructure. Where I particularly see the potential for P3s to have an impact in Indigenous communities is through the fantastic ability to bring design innovation, to address risk transfer, and the full costing of assets, including the very important role of operations and maintenance. I wanted to tell you about some of the early successes on P3s in Indigenous communities. In Northwest Territories, you may be aware of the Talicho project that is part of a P3 effort to build an all-season road to Wati. Wati is a First Nations community 160 kilometers northwest of Yellowknife. And this is a year-round road. It's going to connect the community, allow for increased economic development, and reduce the tremendous costs of transporting goods and services in and out of the town of Wati. You may also know about the very successful P3 that enabled the building of Iqaluit's beautiful new airport that just opened officially in the last couple of months. Very interestingly, this project had an Inuit's benefit package that provided for a number of jobs related to construction and ongoing benefits. And it's my understanding that the agreement requires that 60% of employees be Inuit by the end of the contract, which is fantastic news. Out in the Atlantic Policy Congress aims to create a single water authority to oversee water and wastewater facilities and services for all Atlantic First Nations. And the APC is interested in procuring infrastructure in a bundled P3 approach. Ces exemples représentent des occasions à ne pas manquer pour le secteur des entreprises. Alors, nous reconnaissons que cet esprit d'innovation doit animer la mise en place des projets d'infrastructure dans les communautés autochtones. Et, plus significativement, nos partenaires autochtones voient le potentiel dans les projets spécifiques ainsi que dans le besoin de créer la capacité pour les communautés elles-mêmes de participer activement dans ces projets. You will know from the experience with Infrastructure Ontario, Partnerships BC, and other examples that the creation of intermediary institutions is critical in supporting communities' involvement in P3 projects. Fortunately, we have some terrific leaders in Indigenous communities who see this potential and are driving forward with the development of a range of supportive institutions. I want to call out in particular, I'm not sure if he's here yet, but Manny Jules is, I think, expected today. Manny is the CEO of the First Nations Tax Commission, and it's an organization that builds capacity in First Nations communities to move to more sustainable revenue platforms. He's been working with other Indigenous leaders to explore ways of bringing P3s and other financial innovations into the First Nations infrastructure space, and our government's very proud to support the work that he does. The work of the Tax Commission, along with the First Nations Financial Management Board and the First Nations Finance Authority, are building those important foundations upon which this work will move forward. Just last week, you should know that the First Nations Finance Authority completed their 4th successful debenture issuance on the financial markets and raised $126 million in new funding that will benefit Indigenous communities. And I should add that the demand from investors was twice that which was available. So to the extent that we see challenges across the country, we see an amazing amount of opportunities. And I hope you are seeing yourself as part of the solutions in addressing these critical infrastructure gaps. So here are some of the steps that I hope you'll take in the coming weeks. Learn more about these successful projects in Indigenous communities, and consider partnering with Indigenous communities in ways that benefit both parties, both creating opportunities for yourselves along with jobs and economic growth for communities. Consider policies that you can implement now around the hiring of Indigenous employees in your companies, and explore some of these new models to finance, design, build, and operate and maintain infrastructure in Indigenous communities. If there are any additional steps that our government could take to unleash the potential of P3s in this space, please let us know. We will continue to work closely with Mark and his team at C2P3 to ensure that we capitalize on your experience. I want to close with something that I heard from Bill Clinton 10 years ago when he gave a speech, and a few sentences from his speech have always stuck in my brain. He said, "The longer I live and the more I travel, the more I realize that intelligence and effort and ability and dreams are evenly distributed across all humanity, in every country, in all races, religions, and cultures. What is not evenly distributed are the mechanisms to give life to all those things, the opportunities, the investments, the systematic capacity that establishes a link between a person's intelligence, ability, efforts, and dreams, and the picture of life that emerges. That's what success looks like for our new department. We should ensure that a First Nations, Inuit, or Métis child born in 2017 will grow up in a country that enables the opportunities, the investment, the systematic capacity to breathe life into their dreams. They should expect the basic necessities that every Canadian child expects: clean water to drink, nutritious food, a well-equipped school, a sturdy home, surrounded by their family and culture to nurture them until they're ready to launch into the world, take on meaningful employment, and contribute to making our country even better. I believe you can help us work towards such a future. Thank you for what you are doing to provide hope and justice for all. Merci beaucoup, Chimigwech.
Well, Minister, thank you very much. You, of course, have the benefit of having a look at the questions that are now beginning to roll in. I also know that you have a flight back to Ottawa in the next few minutes, so I think we'll take a couple
Okay.
and then enable you to pull away so that you can actually make that flight, although we'd love you to miss it and keep you here. The first question is, what policies need to change to allow greater private sector participation in First Nations infrastructure?
Great question, and you all may be more suited than I am to be able to answer that question, because what I discovered as Minister of Health is that we don't always, as ministers, realize the regulatory barriers that have been put in place. The good news is that when you tell me what regulatory barriers you're confronted with, I have the tools to be able to change them or tear them down. So those are exactly the kind of things that we want to hear from you. What's blocking you from investing in these areas? But I would say that I think I alluded to some of that in my conversations around the need for external institutions. So we look, for example, at the possibility that has been raised by people like Manny Jules and others of actually developing a model not dissimilar to the likes of Infrastructure Ontario, potentially a First Nations Infrastructure Institute that would actually enable and activate the ability for P3s to be put in place. So there's some very active work at looking at a model like that that would allow us to be able to facilitate these opportunities.
Thank you. And maybe we can skip to the third question and ask you whether you've explored bundling smaller projects, such as water or wastewater projects, as a way to tackle the number of high-risk systems.
Absolutely. So here's an area where I think that P3s has so much opportunity. I was frankly stunned to realize how little bundling is taking place, and particularly in the area of procurement, both for housing but also for water and wastewater. So in Canada, you may know that there are 643 Indian Act bands. Now, these were put in place and divided into 643, not because that's actually the inherent structure of First Nations. In fact, it's estimated that there are probably were 50 to 60 First Nations, but they were divided at the time of the Indian Act into hundreds of different communities. When it comes to things like water and wastewater, for the vast majority of them, they are going out and individually procuring their systems. There's not a place to go to say, which water systems work best in what communities, how can we do some joint procurement, how can we make sure we build O&M into the procurement. So there is a massive amount of opportunity led by First Nations, Inuit, and others to be able to build the capacity for some of this bundling, for the opportunities to say, let's figure out which of these water systems are failing frequently, which ones are actually successful, who's got the strong O&M that has a long-term track record for success, and we don't see these constant breakdowns. So there's tremendous opportunity there. I would absolutely welcome people getting in touch with you, Mark, and through you to me, we can talk about what can be done to offer much more effective systems so that people's limited resources will be used most effectively.
Thank you. If I could ask you one last question, which actually is not on the list you see in front of you. I know you have a particular passion for introducing innovative technologies into the agenda for enabling government to address the kinds of issues you've been talking about today. Could you talk about that for just a moment? Let us get a better sense for what you're thinking about.
Absolutely. So I think what Mark may be alluding to is a conversation we had in Ottawa a couple of weeks ago, because we were talking about some of the things, and I know that for the most part P3s have been applied to sort of physical infrastructure, but I talked to him a little bit about the healthcare space, which is an area that I'm particularly interested in. And one of the challenges that we face in this vast country where we're widely separated from one another is trying to get delivery of things like education and healthcare to the most remote parts of our country. Once we get the broadband in place, and we still have massive gaps in broadband infrastructure, but I think Canada is well placed to be able to show what remote care delivery in health or remote education distance delivery could look like in a successful way that actually would build us business opportunities for the world. So for example, there's an increasing interest in telemedicine and things like remote presence robotics technology, where a doctor or nurse in the southern part of Canada can be doing anything from prenatal ultrasound and a chest x-ray right up to advanced surgery and trauma care using sometimes broadband telemedicine and sometimes robotics. If we can figure out how to do that in Canada successfully, we can sell the technology and the methodology for that to a lot of other countries that also have vast land spaces and are very interested in how you can make sure that you get those kinds of allow people that live in remote communities to be able to enjoy the same opportunities of life that we have, where we can walk up University Avenue and find several thousand doctors within a few feet of one another. We got to figure out a way to get them out there to the rest of the country. So if you're interested in that, please get in touch as well, because I think there's a world of opportunity waiting there for us.
Thank you so very much, Minister. I know we have to let you go. What I did want to say is that you've set out some particular challenges for folks in the audience today. I know that there are many people that are truly committed to making a difference in this particular area, so I think you'll see some take-up of that, and I think it's really important to lay out that kind of agenda. I'll say in final thank you, we are going to make a donation on your behalf to Habitat for Humanity in recognition of the time you spent with us today. And one more time, I hope everybody here will join me in thanking Minister Jane Philpott for wonderful remarks this morning.
Thank you. All the best.
Thank you very much. Safe travels. Thank you very much.